You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. You're listening to the Dental Zone podcast, and thank you very much for joining me. I do appreciate it. This is where I share my years of expertise as a holistic dentist. I graduated in 1992, and I've been working holistically since 2001, and I have my own dental practice in Brisbane called Evolve Dental. If you'd like to know more, then hop on over to holisticdentistry.au. But for now, let's get on with the show and get into the zone. I'm going to be sharing some information about how to prevent tooth decay. It's not about brushing and flossing. It's not about, keeping off the sugar. It's about how you can eat to not only prevent tooth decay, but maybe heal some issues that might be going on with your teeth and gums. And so this is an opportunity where I get to give back to you information that I don't get to share when I'm sitting in the dental chair and drilling people's teeth. I'm a member of the International Academy of Oral Medicine and Toxicology. We're a science-based group of holistic dentists and doctors, and we're setting the new mandates for how dentistry should be, looking at oral systemic health, looking at toxicity and chemicals and how dentistry impacts on health and well-being. So it's part of my vision to revolutionise the way people see their dental health and to also help you to understand how you can better take care for yourself. So tonight I'm talking about what to eat to heal dental cavities naturally. The question I get asked a lot is, can you heal dental cavities with food? Can I change my diet and fix decay? Well, the answer is yes, and it's also no. So I'm going to go into that a little bit more and why that's the case. Look, as a holistic dentist, I'm a strong believer in empowering and equipping my patients with the right tools and the right information to get down to what is the root cause, what's really underlying their dental issues. It's not just about treating symptoms. We want to be able to fix any issues that you have and then keep you well. We want to prevent you having problems. And that's certainly the case when it comes to treating dental cavities. Unfortunately, doing a filling is the first line of defense against tooth decay, no matter how minimal the decay may be. Well, in my opinion, while there are some cavities that definitely requires fillings, those that have eaten through your enamel, which is that protective coating, once decay's gone through and it's inside the tooth, those need treating, and particularly those that are going to be deep enough to reach the nerve and cause you pain. However, there are some early, some smaller cavities that you do actually have the power to reverse on your own at home without the dentist intervening, without us having to get the needles and the drills out. And that power to reverse those very early cavities that are still in the outer surface comes directly from the foods that you do and don't eat. Obviously, the best way to treat cavities is to avoid them altogether. And the good news is that the diet that I'm going to recommend that helps to heal existing, the small or surface cavities will also help to prevent new ones forming. Before we get into the specific foods that can heal and prevent cavities, let's look at how cavities actually form in the first place and what role foods play in that process. Well, there's four main factors that I consider play a role in dental decay. The number one is your saliva and its properties. It's the flow of the saliva, the consistency of it, how much minerals does it contain, have you got a good volume of it, what's the acidity, what is the enzyme and balance in it. If you don't have enough saliva and you have a dry mouth, you are going to be much more prone to tooth decay. Number two is the factors in whether you're going to be at risk for tooth decay or not, or your oral microbiome. And microbiome is such a buzzword at the moment, particularly when it comes to your gut. Your mouth is part of your gut, and it has its own environment of bacteria. And the microbiome is the millions of bacteria and microbes in your mouth. Now, that microbiome can be harmful, it can be beneficial, or it can just sit there being a bit neutral. If you've got a harmful microbiome because you are feeding it the wrong things, you are much more at risk of tooth decay and gum disease. Now, your diet. Now, your diet is important because whether you're getting the right nutrients, so you're not getting enough nutrients, so you're getting the right minerals and all the things that you need to reharden or remineralize your tooth. And then the fourth factor is what do these three elements do together? I mean, if you've got poor saliva, harmful microbiome, and your diet's just not where it needs to be, that's going to create what I call the perfect storm for cavity formation. So the foods you eat on a daily basis will have a direct impact on your oral microbiome, the quality of your saliva as well. And when you eat the wrong foods, you're going to create this ideal breeding ground for the bacteria that cause tooth decay. The quality of your diet is also going to determine whether you are going to get the right nutrients to support the natural remineralization or rehardening process of the teeth. So the word remineralization refers to a process of restoring and putting back minerals to areas that have dissolved or demineralized. Typically, bones and teeth and other parts of the body require certain minerals for their structure. And if we don't have those right minerals, then you get things like osteoporosis and tooth decay. Your teeth are asked a lot of every day. They experience a lot of wear and tear. And their ability to continually regenerate allows you to, under the right conditions, if you feed your teeth the right things and look after them in the right way, you should be able to keep your teeth for life. Now, this process requires specific vitamins and minerals. And if you're not getting them from your diet or from supplementation, you're going to be hindering the ability for your teeth to heal. So let's look at what you can eat to reverse cavities. Well, there are specific nutrients that your teeth need, and I'm going to list them and give you a bit of information about them and what foods that they're in so that you can tailor-make your diet, not only to be healthy and vital, but to have great teeth. Now, number one, and look, I think everybody would know this one, and it's not going to be new news to you, calcium. Calcium has long been known to benefit your dental health. It's going to provide the building and the rebuilding blocks that your teeth need on a regular basis. Calcium helps you to actually produce more saliva, and it puts the minerals back into the teeth that you may have lost from eating. Now, this is where we're going to get a little bit controversial because people assume that dairy products like milk and cheese are the best food sources of calcium. But this isn't necessarily the case. The Dairy Association has a lot of clout and it has a lot of marketing dollars, and it's been able to get this message through that you need dairy to get calcium and that without it, you're going to be calcium deficient. There are many people who have an allergy or an intolerance to dairy and to dairy products. A lot of conventionally raised dairy products also contain hormones and antibiotics that will negate any potential mineral effect. And in my opinion, these products should be avoided. When you eat a lot of dairy, it's actually been shown that it creates a lot of acidity and actually strips minerals like calcium from your body. So there are other avenues that you can get calcium from. I do not eat dairy. I have not eaten dairy in, maybe 10 plus years. I am certainly not calcium deficient. I am not osteoporotic. I have beautiful teeth. Never had a feeling. So let's look at things like seafoods like salmon, oyster, clams, prawns. These are great sources of calcium, as are many plant-based foods like your leafy greens, your broccoli, your nuts, beans, cauliflower, figs, and even olives, and I believe oranges to some extent, but I always worry about the acidity with oranges in your teeth. So calcium's number one. Right in behind that, nearly level pegging in my opinion, is vitamin D. This is called the sunshine vitamin. It's produced by exposing your skin to the sun. Vitamin D is actually mislabeled because it functions more like a hormone than a traditional vitamin, or if you're from England, vitamin. It's took me a long time not to say vitamin because my Australian patients don't understand what I'm talking about. Anyway, vitamin D controls the body's ability to absorb calcium and phosphorus. Now, calcium and phosphorus are what make up your tooth structure. So you can be supplementing to the cows come home, pardon the pun, with calcium and phosphorus. And even if you are, and you've got those minerals going in as an attempt to improve your dental health, if you don't have the right levels of vitamin D, you are wasting your efforts, you are wasting your time. Without vitamin D, your calcium and phosphorus ain't going anywhere. There was a review group of clinical trials, and they found that vitamin D was a really promising preventive agent against tooth cavities and decay. And it led to the conclusion that vitamin D may actually reduce the incidence of dental cavities. Look, there was a lot of studies done that showed that feeding kids like cod liver oil, which actually has vitamin D in it, reduced the risk of tooth decay. This was done, back in orphanages a long time ago. I've got a bit more information on that, but I can't recall it right now. So spending time in the sun is the best way to boost your vitamin D levels. Now, you want to be in the sun and not get burns, because if you get burns, you're actually going to deplete your vitamin D. If you live in countries where the sun doesn't shine very much, then you can also get vitamin D in things like mushrooms, egg yolks, particularly in free-range eggs, fish like salmon and sardines. I mean, look at nature. It goes, okay, we're going to put vitamin D and calcium in salmon so you get exactly what you need. Very, very clever. A vitamin that's been getting a lot of press and publicity recently, and you may not have heard of this, and this is a vitamin K2. And like vitamin D, K2 regulates, we're not talking mountains and Himalayas here, we're talking vitamin K2. This regulates the absorption of minerals in the body. In fact, these two fat-soluble vitamins, the D and the K2, they work together, they work in tandem to ensure that teeth have enough calcium, enough phosphorus, and magnesium needed for remineralization of the enamel. So where do you get vitamin K2? It can be found in fermented cod liver oil, egg yolks, you see egg yolks again, chicken liver, and ground beef. So we're going to be looking at a diet that is high in leafy greens, high in things like salmon, seafood, broccoli, egg yolks, chicken livers. I'm not that keen on that, but you can have them sort of ground up and have pate and things like that, but I'd rather stick with my egg yolks. And your cod liver oil. So my nana was right. My nana was right giving us teaspoons of cod liver oil. I used to be like, I'm going to vomit. But obviously she did us a favour because I've got awesome teeth. Thank you very much, Nana. So, some of these old-fashioned remedies, there is complete wisdom in it. It's not make-believe. So let's talk about magnesium. We've touched on magnesium. Now, magnesium is just an amazing, amazing mineral. It is responsible for numerous processes in the body. I actually believe 70% of what goes on in this amazing vehicle happens because of magnesium. So if you're magnesium deficient, you're going to feel tired, you're going to feel off, you're going to get cramps, your digestion's going to be all over the place, you're going to be toxic and what have you, and you're going to be acidic. But Magnesium is also responsible for remineralizing teeth. It controls the balance of other nutrients in the body, including your phosphorus and your calcium. And look, if your phosphorus and calcium are all over the place and it's not regulated, it can actually promote demineralization of the teeth. So your magnesium is just like the balancing act, it's there holding everything exactly where you need it. So where are you going to get your magnesium? Well, you're going to get it in leafy greens and also avocado. Yum, yum, avocado on toast, anyone? Anyway, phosphorus. We've talked about phosphorus, and you need really good phosphorus levels. This has been shown to prevent against tooth decay, but this is where it gets tricky because a lot of the sources of foods that contain phosphorus are actually detrimental to your dental health. So finding phosphorus that's going to benefit your dental health, you need to know exactly what to eat. So phosphorus is present in beans, in grains and nuts. But the problem here is these foods contain a thing called phytic acid. And this is problematic because phytic acid actually binds nutrients in food and it makes it difficult for our bodies to actually absorb them and utilize them. So we want to avoid those foods that contain phytic acid. The good news is that this doesn't mean you're going to miss out on your phosphorus because there are plenty of foods that are free of phytic acid that are good sources of phosphorus, including meats and eggs. Look, if you eat eggs, you should have great teeth. If you eat eggs, you go out in the sun and you have your leafy greens, you shouldn't get tooth decay. Without the phytic acid, the phosphorus found in animal proteins is considered easier to absorb. And this is why, this is my hypothesis, it hasn't been proven, but this is why I think a lot of vegans actually have poor dental health because they're not getting their vitamin D, they're not getting their vitamin K2, they're not getting enough phosphorus, they're not getting enough calcium and magnesium, and everything's a little bit out of balance. So egg yolks, meat, fish, leafy greens, avoid the beans, avoid the grains, avoid the nuts, hit the dairy on the head. Really good brand of cod liver oil here, and I'll share that with you. And I agree, Nordic Naturals is fantastic. It's very pure, it's very clean, it doesn't have heavy metals in, and it has very high levels of vitamin D. So you don't need to take a lot of it. And I believe you don't get that fishy kind of refluxy aftertaste. Look, I don't know about the fermenting bean sleeve. I still don't think it deals with the phytic acid issue. I think it probably makes them a little bit easier to digest. But personally, if you're going to be looking at this purely from the perspective of tooth decay, I would say try and avoid them, try and minimize them as much as possible. So we've talked about what to eat. You want your calcium, your phosphorus, vitamin D, K2, magnesium. If I've missed anything, I'm sorry. So I want to talk about foods to avoid to reverse cavities. So we've talked about remineralization. We've talked about that's putting back the building blocks to get the minerals back in and reharden the enamel. So to build a growing understanding of healing cavities naturally, we also need to look at what demineralization is. And demineralization is the loss of bodily minerals such as calcium salts, especially in disease processes. And it's the process of removing mineral matter or salts, when you demineralize water and you make it pure for drinking. So tooth decay, or really tooth demineralization, is caused by a deficiency of vitamins, minerals, and other nutrients that the body needs to build healthy teeth. It's also going to be caused by eating and drinking things that deplete teeth of the necessary nutrients like sugar and soda and processed foods. Now, you've got a list of foods that you should eat in order to heal cavities, and I'm going to also give you a list of foods to avoid or greatly limit. Look, we all know sugar is bad for your teeth. We know it's also bad for our health. It's implicated in diabetes, cancer, Alzheimer's, heart disease, high blood pressure, strokes. It's phenomenally bad for us. Nature never intended for us to consume the volumes of sugar that we are being exposed to today. But sugar's not the only culprit. If you just I see patients all the time who say to me, don't eat a lot of sugar. And in honesty, they don't. And so we need to look at other foods that are going to promote demineralization of teeth. That if you eat these foods on a regular basis, it's going to make remineralizing and healing cavities naturally almost impossible. So I'm going to talk about foods high in phytic acid. I want to give you a list of what those foods are so you know what to look out for if you're serious about not getting tooth decay. Phytic acid is an anti-nutrient. It inhibits the absorption of your other nutrients, the minerals that you need for remineralization, like calcium and magnesium. Now, it's found in grains, legumes, I like that word, legumes, and beans and nuts. So that's wheat, beans, rice, almonds, soybeans, corn, lentils, probably a few other things as well, but that's what I can remember. You also want to look at, not only refined sugar, but simple starches. And people will be surprised when I say the worst cavity-causing foods are things like bread, potato, and pasta. But it's true. And that's because the simple starch that's in them turns almost immediately to sugar. You eat them, boom, it's sugar. That fuzzy feeling that you get on your teeth after you finish having a high starchy meal, that's from the millions of harmful bacteria that love to feed on these types of food. And so eventually those bacteria multiply, they're out of control, you've got the harmful bacteria, your microbes gone wild, your saliva's all over the shop, and you are going to get tooth decay. You're also going to get bad breath, gum disease, because the bacteria are out of control. So the simple starches include pasta, potato, white bread, white rice. I'm going to have to talk about it. I tried not to, but it wouldn't be, complete if we didn't talk about sugary foods and drinks. Like starchy foods that are going to turn into sugar in the body, sugary foods and drink provide a direct hit of sugar. And that provides food for the bacteria in the mouth that cause cavities. Those bacteria are called Streptococcus mutans. I'm just showing off to prove that I do actually have a dental degree and I'm not just some flipping quack who drills teeth and bangs on about amalgam and fluoride and all the things that I talk about. So these sugary foods and drinks and processed foods are nutrient deficient. And they're making up a large part of our diet. This is called the SAD diet, which is called the standard American diet, but we also have the standard Australian diet. It's likely if you're eating a lot of carbs and a lot of processed and sugary foods that you're not getting enough of the right nutrients in your body, the nutrients that your body actually needs. And it's ironic. We have an obesity crisis, except people are malnourished. We have overweight people who are malnourished because they're not getting any nutrients. So if you're trying to reverse your cavities or not get cavities, then you've got to avoid these foods: biscuits, cookies, cake, confectionery, pastries, my old favorite, donuts, fruit juice, candies, sweets, lollies. I'm also going to say to you, we have this belief that fruits is good for us and it's healthy. And yes, it is when we eat it in the right quantities and in the way nature packaged it. So you've got your apple, it's got its little skin on. That skin's got loads of enzymes. It helps control the sugar ratio. It helps control the sugar release. But, we have this society now where we're convenience snacking and we like dried fruit. So dried fruit is just sugar. sticky sugar that gets in the grooves and the folds in your teeth, and it's really hard to get out, and it's going to cause tooth decay. So when you make a grape into a raisin, you suck out all the water. All the water from that fruit must be removed. And this process concentrates all of those naturally occurring sugars. I see so many little kids eating sultanas, and I'm just like, they're popping them like they're Smarties, because they are like Smarties. They're getting a sugar hit and their baby teeth are rotting out of their head and they're having to go and have general anesthetics. It's disgraceful. We convert these nature packaged fruits into these concentrated things that are super, super sweet. And that's why raisins are much sweeter than grapes. You've now got a little dried up sugar, a little sugar tree. It explains why dried fruits are so horrible for your teeth. They act like sticky caramel. It sticks in your teeth. It traps sugar and the sugar-loving bacteria right onto the tooth surface. And even when you brush it, it's still stuck in there. So no wonder that causes tooth decay. I'm going to talk also about acidic foods and drinks. So we've talked about phytic acid, we've talked about simple starches, we've talked about sugar, and now I'm going to talk about acidic food and drinks. So the acidic found in food and drinks, it wears away the enamel of your teeth. It actually strips and dissolves this beautiful protective coating away from the teeth, and it intensifies any decay. So let's talk about what I mean by acidic food and drinks. Soda, soft drink, coffee, citrus, orange, lemon, and grapefruit. They are highly damaging to your teeth. I think there was a study that found they decrease your enamel hardness by 84%. The acids found in citrus break down the enamel and they cause irreversible damage. Sports drinks, oh my gosh, sports drinks are full of sugar and they are more acidic than a can of Coca-Cola. They are more acidic than soft drinks and soda. Energy drinks, just the same, acidic, sugary. Alcohol, acidic, sugary. Kombucha. This is touted as a healthy drink. It's fermented. It's supposed to get your gut bacteria going. It has a pH of 3.5 and 2.8. That is as acidic as stomach acid. That's lower than coffee, and it's lower than many soft drinks, and it is certainly low enough to dissolve the enamel on your teeth. Acidic food and drinks strip minerals from your teeth and your body, and they lead to demineralization and decay. Look, I'm not asking you to be a saint. It's probably impossible to avoid every single one of these foods all the time, unless you're like me and you are very anal and you eat to be super healthy. And I don't want you to be paranoid, but I want you to just think about the impact that these things are having on your body and your teeth. And the more frequently you have these things, the more harming they are. So if you can't resist, that morning cup of coffee, if you can't get going without that, after you've had it, make sure you rinse your mouth out with water immediately. Wait about 20 minutes and then go brush your teeth. Why am I saying wait? Well, if you've just softened your enamel by up to 84%, what's brushing going to do? You're taking a toothbrush and you're scrubbing your teeth. The enamel is soft, you wear it away. So if you can rinse with water, wait about 20 minutes, let your saliva and the minerals in there help reharden the enamel before you go brush the teeth. So the best diet for remineralization and to prevent and heal small, I'm going to say you can only heal very small surface cavities. If you've got a hole in your tooth, you've got to get that decay drilled out before it spreads, causes pain, and wrecks your life. Anyway, best foods. Foods rich in vitamin D, vitamin K2, magnesium, calcium, and phosphorus. These are going to help your teeth remineralize, and it's going to help fight off cavities. It's also going to help to reverse any current cavity formation through remineralization, through rebuilding. When you eat acidic and sugary foods, remember to think about it wisely. Rinse your mouth out after eating these types of food whenever possible, and maximize your intake of those remineralizing foods. Now, minimize how much of the sugary, acidic, phytic acid containing foods you're having. Maximize the ones that got those building blocks: eggs, salmon, green leafies. The bottom line is this: you want to reduce your risk for tooth decay, avoid sugary drinks and sweets, and slow down the demineralization process. Increase your dietary consumption of those things that are the best diet for remineralizations. Focus on eating the right foods and be aware of the potential consequences of many of the other food groups. And I'm going to be staunch here. Even if you are eating all those things, flossing and brushing, you still must have regular dental checks, because it's like saying, okay, I can do this thing, I can boost my immune system, and I'm never going to get a cold. That's not true. What you'll do is you'll reduce your risk for getting colds. You won't get them so frequently, and when you do get them, they won't be so intense. It's the same with trying to prevent tooth decay. You are minimizing your risk, but the risk is not gone completely. Please visit your dentist regularly, get your regular checks, get the x-rays so we can make sure there's nothing going on under the surface. Let's keep your gums nice and healthy, and let's keep you healthy and smiling and give you a great long life. So I think we'll finish there. This has been What to Eat to Heal Dental Decay. I hope you've really enjoyed it, and if you have, please leave us a rating, a review, and do share the podcast. Let's get the message out there. Let's help as many people as possible have an understanding of their dental health and how to have a healthy smile for life. I want to thank you all for joining me. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. This is the Dental Zone podcast, and it's an absolute pleasure to take the time out and share my expertise on holistic dentistry with you. If you want to know more, hop on over to holisticdentistry.au. If you live in the Brisbane area or you are willing to travel and you'd like to see me for your dental care, then please call our clinic on 07 3720 1811. Thank you once again. Until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.